We want to look at a feature of Anaesthetic Pro that is actually very useful, and that is the ability to plan for an anaesthetic or a surgical procedure. So we look at Anaesthetic Pro and we go under the heading PAGA or Pain Management Plan. When we bring this up, it brings a form up that we can now populate. So we'll go through and fill out those factors that we need to put in. So this animal belongs to the Smiths, and his name is Biff. And Biff is a canine, and he's a British Bulldog. So I'll go down and select that. And Biff weighs 32.4 kgs. Now, the vet is myself, nurse is Bronwyn, and Biff is in for a soft tissue procedure. Now, we have the ability to actually assign a risk to Biff. Now, Biff is a relatively normal, healthy animal, but because he's a brachiocephalic breed, we want to give him a class 2 risk. Now, we need to work through what we're going to do with Biff before we take him to either the anaesthetic side of things or the surgical side of things. So we're going to run some pre-anaesthetic bloods on Biff. We're going to have him on fluids, and obviously he's going to get a pre-anaesthetic. We're not going to perform an epidural, we don't need local, and we don't need a CRI today prior to surgery. During the anaesthetic, he will have obviously anaesthetic induction agents. We've incorporated the pain management into the pre-anaesthetic, so we don't need to worry about that at the moment. We're not going to put him on non-steroidals prior to surgery or locals, and he won't need a CRI at that point. But he will need some post-op pain management, and we're going to give him non-steroidals, and potentially he might have some opioids as well. And depending how painful he is, he may need a CRI, but probably not in this case, and we don't think we'll need to give local. Now, he's in actually for a respiratory condition, being a brachiocephalic breed, so he's in to have his nares opened and soft palate looked at. So now we have a precaution highlighted up here, so he's a brachiocephalic. So if we come down to that, we just read through those precautions, and it just indicates that if we're using ACP or opioids, to use a half dose, and to avoid alpha agonists, and to administer glycopyrrolate, just to make sure that we don't end up with excessive fluid production in the oral cavity. So that's our form. We can now go and print that off, which we won't worry too much about. But what that form does is give us a guideline as to how we're going to manage Biff right through those procedures, and some of the factors that we need to be aware of that potentially are going to make the whole procedure a little bit more risky for Biff. So it's a useful form, and I hope that that vets make good use of it. Thank you.